Hi everyone, I'm Vicky, Principal Dentist at Torrs Dental Practice. I've had a request to do a quick chat about how to look after your dentures and some advice about dentures whilst we are on lockdown. So the first thing with dentures, clean them as you would your teeth. So don't avoid them, don't not clean them just because you take them in and out. You need to keep them really, really clean. And the other thing is leave them out at night if you can. The reason we say that is if it's covering the soft tissues on the surfaces of the mouth, you can get a fungal infection on the soft tissues if you're leaving them in all the time because you're not getting the air there to circulate. So if we can, take them out at night and leave them out. When it comes to cleaning your dentures, top tip, number one, so that they don't get broken. If you're going to clean them over the sink, put the plug in the sink first, fill it with some water so that if you drop them, the water breaks the fall, they're less likely to break. You can also clean them over a towel or over a bowl of water, but just choose something that's going to be like a soft landing surface, and then we're less likely to have any problems with broken dentures, which is ideal because it's a lot more difficult at the moment to get those fixed for you. Also, if they're loose or they're rubbing, you can try a little bit of fixative. That's just gives a bit more stability and hopefully they won't move around so much. If they're really making the mouth sore and you don't need them, leave them out as much as possible. Obviously, there's a great thing about lockdown is we're not going to get too much social appearances. But obviously, if you are embarrassed to not have them in around your partner, keep them in as much as you can. But if it's making your mouth sore and you're okay with it and your partner's okay with it, I would leave them out as much as possible just to keep things comfortable for you at this time until we can get any adjustments made for you, any relines done for you, anything that we need a lab-based technician to help us with. On top of that, how to clean them. Okay, so I always recommend to all of my patients after eating, take them out, give them a good rinse round, give your mouth a bit of a rinse round just to get rid of any food debris. That makes them more comfortable to wear as well, and they're less likely to drop because there won't be things getting in the way of suction and stability. So it's a really good tip. You can just use a toothbrush to clean the denture. You don't need any particular things. If you've got a denture brush as well, that's great. And you don't need lots and lots of tablets and things. Every so often a Sterident is a good idea, but we don't need to be doing it every day. Please don't put them in bleach. I've had some people do that and that does tend to ruin the denture completely, so let's not put them in bleach. Best thing is just a bit of warm soapy water. So that's not too abrasive, it's not going to damage the denture at all, but it is going to give everything a very good clean. So like we were saying, make sure that you're cleaning it over something that's soft or the sink that's full of water. And you warm soapy water and your toothbrush, give them a really good clean, get into all the little nooks and crannies, give them a good rinse off, and there you go. Nice, beautiful, clean denture. If you want to do a Sterident, do it once a week, but don't put them in bleach. Leave them out at night, and if they're causing any problems as well, please leave them out. All right, hope that helps. Take care.